how do I make sure that I am the next choice for that role? How do I make sure that out of all these opportunities I'm being offered, I take a breath and appreciate and maybe start to recognize that I'm awesome.
Hello, my name is Shirley Kavanagh, and you are very welcome to the Leadership Discoveries podcast. In this series, I chat with leaders across a variety of sectors and geographies who share their experience and views on a range of leadership topics. I'm delighted to have Ashley Cox with me today. She's a strategic leader in the life sciences sector and female founder who has recently founded Caledonia Life Sciences. And this is a consultancy specialising in corporate strategy and business development for early stage biotech and pharmaceutical companies. She has held senior roles at prominent firms like Eversana and Smart Analyst. And Ashley is also a dedicated advocate for women in the healthcare profession, having held roles at the Healthcare Business Women's Association, including regional chair of Northern Europe and president of the London chapter. Ashley, you're very welcome.
Delighted to be here, Shirley. Thank you for having me.
We'll have to watch we don't talk too long. As two Gaels, I have to say, there is a danger that we will do that. But anyway, I'm going to keep an eye on the time on this one, Ashley. You're based in London and you've recently founded your own company, Caledonia Life Sciences. Congratulations, first of all. How does that feel?
Thank you. I think it feels equally exciting and terrifying as all these new ventures do. I think it's exciting to be able to go out into the world by myself and focusing on areas that I'm super interested in. And I'm loving the freedom that's coming with that, being total master of your own destiny. But obviously, it comes with a level of anticipation of, oh my goodness, what's happening? How's this going to go? But I think that's part of the joy in a strange way as well.
Great. And tell me, is there a gap that you want to specifically fill in terms of serving clients? Because I'm conscious that some current or future clients indeed may be listening to this.
I mean, I've been in this space for kind of 15 years, focusing on understanding opportunities and really bridging that gap at the earlier stages of clinical development between R&D and commercial. So asking those commercial questions earlier on. And I think the gap is that, as we very well know, there's a lot less funding, partnering is harder. And, the ability to really evaluate opportunities, but more importantly, to communicate the value to potential partners, investors has never been more important. So I think that's the space that I sit in. I'm not a big organization, so I can be much more cost efficient, but it's not the quality that's less. I'm not the cheaper option. It's really, how do we really understand what are the key questions to understand if this is going to be a viable opportunity in the future and worthwhile progressing.
And you talked about value there, Ashley, and how do you articulate that value to a client, particularly when you're just starting off as such? Is it around the partnership piece? What is it?
I think it's the flexibility and my experience that I can bring. I think the value is that, I can work in a very different way to a lot of other consultancies because I don't have these big P&Ls. I don't have hundreds of offices and people. And I think that, I can take a much more personalized approach with each of the projects. I have a team as well of folks in India that I'm working with. I've, known these guys for kind of 8-9 years now, and primary market research. So I have the ability to either work as an independent contributor, or I can pull in secondary and primary data to really support the learnings as we go on. But focusing on, understanding the commercial opportunities, because I think when we talk about value as well, it's been the same way for years. I mean, there's some great science, but great science isn't enough anymore. You're going to have to look to the future and really understand, what's the pricing and reimbursement going to be? Who's going to actually pay for this? Because if you're going to be sevens, or there's not going to be an unmet need when you launch, it doesn't matter how good the science is, you won't actually have a successful outcome. So really looking at today's decisions to impact and drive that future success is where I'm positioning.
It's a great time to be in the pharma sector as such, or the life sciences sector, because so many interesting things going on and so many fantastic innovations, that when we think, I suppose, of where we've come from over the past couple of years to where we are now and where we're going, it's kind of extraordinary in terms of science. And when you look at that, Ashley, what has changed, for you? Because, I've mentioned a number of great companies there, Eversana, Smart Analyst. Like, what's changed in the life sciences space, do you think? Is it the pace of innovation? What is it?
I think it's the pace of innovation. I think the change in focus as well. There's obviously been a huge focus on oncology and then immuno-oncology, all the CAR Ts, everything like that. And now we're starting to see a lot more immunology, oncology drugs being transitioned into that space and lots of trials there. I think that the real joy of our industry is that it is continually evolving. I mean, one of the reasons I love being a consultant and love working for those previous companies is every day is different, every challenge is unique, and that is something that's like super engaging from my perspective. So I think that the industry's obviously taken some bumps. There's been some big phase 3 failures, share prices and a lot of the companies are challenging, but I think that at the end of the day there's still patients that are suffering from really terrible diseases that will hopefully have cures in the next 5 to 10 years. And that is the kind of motivation that keeps it all going despite the hurdles that the industry has faced over the past 5 years.
And that excitement that you talk about, Ashley, in terms of your own self moving into the consulting space, that's kind of a big courageous jump, isn't it? To move from the security of the body corporate into running your own advisory practice as such and strategic consulting practice. Any advice for people who might be thinking about that at the moment or who've just actually made that leap themselves?
Absolutely. I mean, I think, I started the company earlier this year, but really took the summer off to spend time with my family. So it's really, I'm kind of 2.5 months in. So the summer was spending time, organizing all like the tax and the IT and all this kind of fun stuff. And there, my advice would be like, my goodness, like work with experts. Don't try and do it yourself. I mean, the muddle I got myself into, my accountant is amazing. If everyone worked in the way that he did, life would be super simple. I've said that hundreds of times. Even from an IT perspective, just get somebody, a friend, a professional, make the investments into working with people who actually ultimately know exactly what they're doing, because it saves time, it saves wrinkles and gray hair, that is for sure. And then I think the other thing is that I found so promising is that, I've spoken to a lot of people. I've pressure tested this message with past clients, friends, people from HBA that you mentioned, to really understand, is it just me? Am I identifying this? Do I think this is a good idea? And everyone else is going to go, are you off your rocker? What a terrible idea. That's ridiculous. Don't do that. So speak to people, network and network and network. Just have as many conversations as you can as you're looking to adapt your kind of business mission. And also, don't be afraid to ask, be brave. That's one of the kind of key things. And I've been blown away by how supportive so many people have been and how keen people are to help me. I've had conversations with folks who, maybe haven't worked with for years. And all of a sudden they're like, oh my goodness, send me your slide deck. I know 4 companies and I'm happy to be an advocate and share. And that's just, such a wonderful position to be in. And it makes me feel very grateful for the network. But work with experts, use your network and talk to as many people as is humanly possible.
I love that, Ashley, and I love that be brave, that whole piece around networking, the importance of networking. I just want to flip the conversation just a little bit to the whole area of women in STEM, because over the past number of years, we've had numerous campaigns globally and at national levels to encourage women into STEM subjects. Now, I know your own education is in the field of neuroscience and pharmaceutical analysis. Are we doing enough to encourage young women into the science subjects, and what more could be done?
I don't know if we'll ever do enough. I think that, you look at the numbers of students coming through and they're increasing, from a female perspective year on year at the universities in STEM subjects. So a lot is being done. I know certainly from personal experience, my daughter's school is super supportive. She wants to go into medicine. And I think that the last 10 years, especially the last 20, then from when I was at school, really understanding that the opportunities are there to be taken and women are being supported to take them, I think is something that's evolved really well. But I think that having, again, I think from early stages of career or university or school, the encouragement of speaking to people doing roles, to speaking to industry. And I think that one of the things, again, my daughter's school does is they have people come in and talk about their industry and where the roles are, and then do open Q&A to classes looking to make decisions. And I think that at grassroots level, that is where the biggest impact gets made. I think you can do national campaigns, run adverts, all kinds of stuff. But I think that the earlier everyone's made aware that these options are available and some of the opportunities, but also the challenges and what actually looks real life. Because I think our industry is great, but it's super opaque. If you're on the outside looking in at biotech or pharma, you're looking at, okay, what's the difference between like pharmacovigilance? What's medical information? How does that differ from, all these other different components? And you really only find out once you're having the conversations. And I know with HBA, we ran an initiative, which Andrea, one of the previous presidents, had started, where once a month we would like invite students to come free, and you just have 4 people sitting discussing their careers. And that was really impactful. That made a huge difference. So we can always do more, but I think the earlier we start, the better, and we should be focusing there.
Great. Thanks for that, Ashley. And as you say, it's something that it's been a topic of conversation for a long time and will continue to be, I'm sure. But, having great role models is probably one of the most important things. You mentioned the HBA there, the Healthcare Businesswomen's Association. I know you've been a great advocate for women in leadership. Before we went live here this morning, we had a funny interaction where you complimented me on something and I said, oh, well, you should have seen me like 10 minutes before we got on the call in terms of not being physically coiffed, let's say, and you made a comment which kind of, I'd probably like to explore just a little bit in terms of let's just accept the compliment. So women in leadership and how we act. Do we self-sabotage at all, do you think?
100%.
Oh,
Without
right.
question. Yeah, if I had a pound for every senior leader that I spoke to who was a woman who has doubts or has the imposter syndrome and all these kind of buzzword topics that we really talk about, I would probably be living on an island somewhere. And I think it's incredible that, even in this day and age, we're so quick to put ourselves down. And, everyone says, even talking about my business, like, oh, you've been so brave, you're so inspirational. I'm like, oh my goodness, it doesn't feel like this. And, we're just not ready to accept the compliments. And I think one of the biggest issues is, getting more women into senior leadership roles. I think that getting the women into the roles is becoming a bit easier, still work to be done. But actually, once the women are in the roles, what support is being given to allow them to actually flourish? It's like, oh, well, we've hired someone, excellent, off you go. And this will apply to men as well. But I think especially women, when they're looking to take that next step. I had a conversation with 2 ladies recently, and it was even just as simple as like reframing the question, like, what do I need to do? Because how do I make sure that I am the next choice for that role? How do I make sure that out of all these opportunities I'm being offered, I take a breath and appreciate and maybe start to recognize that I'm awesome and I have all this external validation, but how do I translate that into me feeling that way? I think there's still a gap there.
Very interesting. And just in terms of when you think of the life sciences sector, particularly, are there any challenges, particularly in that sector? I know, as I said, you've worked a number of years with the Healthcare Businesswomen's Association. Is there anything you see in this sector that you say, you know what, we need to change that?
I think it's getting a lot better. I think there'll always be things that need to change. There's lots of reports. There's the McKinsey Lean In report that's always really interesting, looking at women in the workplace. And across all sectors, it's saying it's going to take another 50 years to get to gender parity. I think that certainly in the life sciences sector, there's a lot of focus and people are making great strides on having things like similar maternity and paternity. So you're taking any bias away from, people of childbearing age and, having all these different initiatives to make sure that you're not going to actually start interviewing candidates until you have 3 women that are potentially applicable for the job. That takes patience, that takes time, that takes intention. I think one of the biggest problems that the industry is suffering, and actually if we're touching on it from the previous point as well, is, women are finding it harder to get these entry level roles, which then creates a whole bias of underrepresentation throughout all the senior levels. Because if you're starting with a lower number, you're obviously going to end. And again, I think it's offering the support. When you talk about self-sabotage, I mean, the studies that have been done on the fact that we don't tend to typically put ourselves forward for roles unless we've got like 8 or 9 out of the 10, key things that are being requested. Whereas in the studies, like men had, like when they had 4 or 5, they were putting themselves for it. So it is that having that confidence, being brave and asking the questions. We should be better at asking the questions as opposed to having our internal dialogues, which may actually be detrimental across everything.
And Ashley, it's great to see those organisations that when they are actually putting roles out in the market, that they actually acknowledge that you may not have all of the skills that you actually need. And I think that's great because that, creates the opportunity, I suppose, for opening it up to broader populations, and underrepresented social groups as well.
Absolutely. And I think it's great that people are putting that. But I think that of all the differences we could make, one that would make the biggest impact is if we were braver and we all decided as individuals to put ourselves out there, because what's the worst that can happen? You don't get the job, you don't get the interview, but hopefully you'll take a learning, or they'll say, right, this is your gap. And then you've got something to work on. Nobody is perfect. And I think that having that understanding that you don't need to be able to do absolutely everything from day one, but also that the employers are going to be supportive and encourage you to not necessarily fail, but appreciate that you're not going to have roaring success in the first few months. So that whole, okay, this is a much longer term role. How do we make sure that everyone's set for success and everybody is comfortable while they're doing it?
I love that message that you're giving out there, Ashley, because I think for me, what I'm hearing is this sense of we need to empower ourselves as well, rather than wait for it to be given to us. A message across genders, I have to say, that this ability to empower ourselves.
Absolutely. And I think that that is the critical component. And I think that, one of the key things, to go back to some of the earlier questions, you need to have a support group, you need to have cheerleaders, but you also need to have mentors, coaches that can be brutally honest, that aren't necessarily your friends, that you can really say, is it me? Is it them? What do I need to do? And give you that space to actually work through things. Because I think the problem is when you're in the situation, you're looking for a job, you're dealing with challenges at work, even professional and personal challenges. When you're in it, it's very hard to see. But if you speak to somebody and they give you that space, it's much easier to look at from an external perspective and say, right, okay, this is what I need to do, as opposed to just keeping on struggling.
Ashley, when you look back over your career to date, are there any people, any leaders that you see where you say, actually, they were inspirational for me? They inspired me. Anyone that you can think of, and you don't necessarily have to name the names, but, even the people, the types of people that you've met.
And I think, you learn so much from really great leaders. I think you also learn a lot from really terrible leaders. I think that, if we start there, and I know that's not the question, but I think one of the key learns is for anybody going through this, who's dealing with a bad leader, is you're going to learn so much for them because you'll never make another person feel the way that they made you feel. So the great leaders that I've had have been caring, have empowered me, but with them like standing shoulder to shoulder beside me. So I'm able to they've been very clear with expectations, very clear. I think there's a lot of discussion about empowerment and we need to empower people, but empowered people need to know what they're working towards. Otherwise, there's a lot of, indecision and uncertainty. So the great leaders I've worked well with, many who I've kept in touch with throughout my entire career, have always been incredibly supportive, incredibly open. I know that they have cared about me as an individual as well as what I can offer the organization. And I know that, I have their support. They appreciate the fact that I work hard. They share things I've done well. I think that we need to get better at celebrating success, banging the drum for everybody, and really have just made me feel secure because I've known where I've stood. I've had some leaders who, in my very distant past, who like to drop like bombshell surprises of things they didn't think I'd done well, but had waited like 3 months to tell me. And I'm just not that person. Like I spend then a period of time and anxiety going, oh my goodness, what else have I done that they've not brought up? So yeah, clear, concise, supportive, empowering, absolutely not micromanaging, and giving somebody the freedom and the trust that they knew I was going to do a good job and work my socks off.
Ashley, I'm just listening to you there, and let's bang the drum for somebody here on this conversation. Anyone you'd like to call out who's actually fitted that bill, that description you've given?
Oh my goodness, yes. So John Lequier, who was my boss twice because I worked at Smart Analyst and then I left and then I went back. He was just always completely so supportive and so calm in the middle of all the different storms, through
Hmm.
COVID, through early stage career. I was, one of the first people in Europe with Smart Analyst. So it's a big challenge. It'd been kind of not had some people there for a few years. But he was just so supportive and he would come over and I never felt like he was judging me. He was very much just like, right, okay, well, we actually offer this. And maybe when that client said that, you could have said this. But it was so like directional and supportive. It wasn't like maybe in some years where people would be like, why didn't you see that? Why didn't you do this? And kind of calling you over it. But yeah, he especially, I've had some great leaders. I mean, gosh, going right the way back to the beginning of my career, I could probably name about 8 people. So I hope nobody feels offended. I'm not mentioning their name, but he's just a very recent example. And then Mike Ryan at Eversana is a phenomenal leader, Irish, totally leads by example, calls a spade, is very clear, is very direct, you know exactly where you stand, but also a really, really good person, really kind as well. So he'll be horrified I'm saying this. So
Yeah.
there we go. I'll need to send it to him and make sure he listens.
Fabulous. Thanks for that, Ashley. Looking forward now and looking forward into 2025, interested in terms of your take on leadership in 2025. We're going through a significant period of change, as we have been, I suppose, over the past 2, 3 years, 4 years even, and probably a lot more change to come in the future. What do leaders need to be? What do they need to focus on? What will be important, do you think?
They need to be authentic and they need to be empathetic. That's the two most important things. I think being authentic is the most important thing to be a leader because if you're not, I think people can see through things very, very quickly. So if you're trying to be somebody that you're not or project, a situation that isn't real, everybody can see it. That marks uncertainty. Why are they acting like that? Why are they saying that when we all know it's not true? And I think the empathy side of it is really just being able to understand that 99.9% of people are out there doing the best that they can on a daily basis, working hard, they want to be successful. Sometimes there's things professionally or personally that, come into the field that means you're maybe working at 90%, not 150 as per usual. But also understanding people's careers, their hopes, their dreams, and putting plans in place to know that they're going to be supported to achieve them. I think from an empathy perspective, that is the most because if you're working for an organization and you know that they are set to develop you, you are going places, you are working hard, you will never be more engaged and motivated. But the flexibility as well, I think there's give and take on both sides as always. And I think that is something that's super important.
Great. And, you mentioned at the beginning you have a team in India, and I know you've worked across different cultures. And I'm really interested in your view on this whole area of cultural intelligence. How do we work across cultures? How can we develop that cultural intelligence?
I think be intentional and be interested. Ask the question. I mean, it's Diwali today. We're doing this recording. I'm reaching out to all my friends who are celebrating Diwali and probably some that aren't. But I think it's that whole inclusivity that you're being respectful, but more importantly, curious. Like, I love learning about people. Like, I am so nosy, like, I love interviewing people. I love networking. I love getting to know. So, different backgrounds and cultures is fascinating. And I know the richness that it brings. But I think also, just being very clear on, what's important. And, I remember, starting at companies, and, some of the folks in India calling me like ma'am, or, something like that, and saying, look, I'm Ashley. Like, I don't come with airs and graces. I don't need to have, and you make me feel like I'm about 150. So I think that, kind of having those discussions as well, and just being yourself, be curious, be inquisitive, learn as much as you can, because I think the one thing that we should all be able to agree on by now is that the more perspectives you have, the stronger and more robust any outcomes, be it company or project or just opportunity.
I'm glad you reminded me of Diwali, I have to say. So, very happy Diwali to any of our former colleagues, Indian colleagues, and current friends as well in that space. Final question around technology. Past 2 years have been the 2 years of generative AI, in fact, and no doubt next year will bring us even something more exciting. Hopes and fears, Ashley, for technology.
Yeah, I was actually at a conference a couple of weeks ago, and this amazing chap, I won't say his name, did a really great talk on the 7 cardinal sins of AI, and, some of the challenges there. And I think that ends up that, there's going to be good and bad, as with everything. Look at the internet, how that's changed positively, but also the negative impact it's had. I think that at the moment, there's a lot of buzz around it. I think there's huge, huge opportunity to make our lives easier. Scheduling, building PowerPoint slides, expenses, my goodness, anything like the real kind of stuff that takes time away from an administrative perspective, I think is really fascinating. I think some of the scary stuff is, these maybe some of the avatars, things, people being replaced, and, words being put into people's mouths and things like that. I think that's scary. I think less so in our industry, but certainly, to completely change direction, in the film industry, you see what's happening there. People are signing the rights away forever. I think that can have a real detrimental impact. But I think that overall, we're at a stage where excitement is building, but I do think it will level out and become a useful everyday tool. Will it replace some jobs? Yes. But at the end of the day, other jobs will be generated because of this. And I think, especially in pharma and especially in strategy, you're always going to have that human element to take data that can maybe be generated by AI, but turn it into so what does this actually mean to this asset, our organization, our employees? And that would probably be the way that I would frame the kind of hopes and fears that I have about this massive technological change.
Thanks for that, Ashley. And listen, this has been a fantastic conversation. I've really, really enjoyed it. And it's been so wide ranging at all. I mean, the best thing about some of these conversations is I just never know which direction they're going to take. And this I've thoroughly enjoyed. Ashley, thank you very much for giving me your time here today.
Oh my goodness, thank you for the opportunity. I've loved our conversation. I've always loved our conversations that we have. So good to get one of them out in public, at least, Shirley. Yeah, absolutely. Happy to, participate anytime.
Thank you very much indeed, Ashley. And I want to thank you, our listeners, too. I suspect you've come from very different parts of the globe and from within different industries also. And I hope that you have found the discussion as insightful and as thought-provoking as I did. By the way, if you'd like to contact me, you can do that on LinkedIn or on shirleykavanagh.com. To our listeners, I hope this has been as useful to you as it has been for me.